Good evening, everybody. I hope everybody is doing well. I am Crystal Spain. I'm the chair of the South Carolina Democratic Party, and welcome to our third virtual town hall. And tonight's conversation is about a very important topic, healthcare. And we are so delighted to have you guys join us today, as well as with some esteemed guests and experts in the field of policy and medicine. We have Representative Lauren Underwood from Illinois, and Dr. Annie Andrews from our very own South Carolina. So we're ready to get started. We've got your previously submitted questions, and we'll also be taking questions out of the Q&A chat. So if something comes up and you want to ask a question, please drop it in the chat and the staff will get it out, get it up to us, and we'll make sure that I ask those questions to our panelists today. So we're going to begin with some opening remarks, and we'll begin with Congresswoman Lauren Underwood.
Well, Crystal, thank you so much for the invitation to join you tonight, along with so many members from the South Carolina Democratic Party. I am delighted to be here with my friend Annie Andrews. I remember when she ran for Congress, and she's been such a great partner as we're lifting up the need to have high-quality healthcare for all Americans, particularly kids across all of our communities. For those of you who I haven't met before, I represent a community outside of Chicago. I live about 45 minutes west of the city, and I'm a registered nurse and spent my career working to expand healthcare coverage in communities across our country. I worked on the Affordable Care Act. I was served in the Obama administration and decided to run for Congress after my congressman voted to repeal the ACA and make it difficult for people like me who have pre-existing conditions, make it hard for us to get our health care. I flipped a seat in 2018 and became the youngest Black woman ever elected to Congress. I'm in my fourth term and serve in House Democratic leadership on our messaging arm, where I'm helping our House Dems be better online. So that's been a really fun adventure, as I'm sure you can tell. Crystal knows, because she's worked with a lot of our members before, that we have a range of talent and comfort level with online communication. So anyways, I just say all that to say, I'm really excited about this town hall tonight. House Republicans spent all of last night in the cloak of the darkest hours trying to rip away healthcare from 14 million Americans. And they passed their bill out of committee, and they're still lying about what it would do. But what we know is the Medicaid program covers half of kids in this country, and the effects of this tax scam would be devastating on communities all across South Carolina, on communities all across Illinois. And I'm so happy that we're having a chance to huddle about this tonight and make a plan for the way forward. So thank you for having me. Delighted to be here.
Thank you so much, Congresswoman Underwood. Dr. Annie Andrews.
Yes, thank you so much, Crystal. It's a pleasure to be here. I'm honored to be here with the Congresswoman. I've followed your career since your first run and can't believe you're in your fourth term already. That's incredible. We're so lucky to have you representing patients from all across the country in Washington, D.C. So as Crystal said, as some people may know, I'm a pediatrician. My whole life, I knew I wanted to be a doctor. I told my preschool teacher when I was 4 that when I grow up, I want to be a doctor and a mommy with 3 kids. And that's exactly what I am today. I never had an interest in politics. I have taken exactly 0 government classes or political science classes, but I'm sure, like the Congresswoman, after spending year after year at the bedside of sick and injured children, working in a children's hospital here in South Carolina, I started to understand the way in which policy impacted my patients. And if you want to affect policy, you must engage in politics. So I tell people that the only reason I care so deeply about politics is because I care so deeply about the 73 million children in this country. And I know we can do so much better for them. And healthcare is the foundation for every child in this country to reach their best and brightest future. And I like to paint a little bit of a picture of what it's like to walk into a children's hospital every day, because I think we forget that most people on the outside don't understand what it's like. So for years, I cared for children who were in the throes of a mental health crisis and couldn't access mental health resources. I cared for children who had to spend the night in the hospital alone because their parents were juggling multiple jobs just to make ends meet. I would be standing at the bedside of a children with a newly diagnosed chronic disease like diabetes, and the parents would have to interrupt me and say, well, doctor, how much is that insulin going to cost? And I certainly have cared for far too many South Carolinian children who have been shot. And so when you see that every single day, you start to look for answers and you start to understand where the power lies. And that's what drew me to engage in policy at the state level and then in politics by running for office in 2022, because I believe that healthcare is a human right. And I know that our country can do so much better. And South Carolina is, on the front lines of the healthcare crisis, the mental health crisis, the reproductive healthcare crisis. And I'm so grateful to be having this conversation. It could not be more timely. So thank you so much for having me.
Thank y'all so much. Woo, very powerful and very, I don't want to say upsetting, but very upsetting. But let's. So we've got, like I said, we've got some previously submitted questions, and if you have something that's burning, a new question that's burning inside your mind based on their opening remarks, please put them in the chat. And so what I'll do, ladies, is if it's specifically for you, I will say you, and then if it's not, I'll just, if you feel called to answer it, go right ahead, give your best answer. So we're going to start with a question from Charleston. With this RFK now in charge, who doesn't believe in vaccines and has fired all the researchers, what are the vulnerable going to have access to? Flu shots, pneumonia vaccines, COVID, question mark. Some of us have health issues that would put us at great risk. You want to lead us off, Rep. Underwood?
Well, it's deeply concerning. The new Health and Human Services Secretary, Robert Kennedy, is completely unqualified to hold this position and is doing real harm that I am very concerned will lead to an increase in deaths all across the country. The good news is that he cannot singularly take these life-saving vaccines off the market, right? He cannot prevent you from being able to get the care that you need. What he can do is he can make it very expensive. He can make it very confusing on how to get that vaccination or where to go or whether or not it's recommended for you and things like that. And so that's where, having a relationship with your primary care provider, sometimes we call that a medical home, is really important, whether you have that doctor or nurse practitioner that you see in your community. That's going to be a great resource for you as you're navigating getting vaccinated. Another great resource are local health departments, because they often have sometimes free resources too, if cost is a consideration. And then, we have good old-fashioned common sense. And I think that we have to be that positive reinforcement for those friends and family members in our lives who might need to hear from us about the value of preventing illness and keeping our families safe from, diseases like the measles or, the flu or any other item that might be of concern.
And I'll just add to that, like the Congresswoman said, he does not have the power to take away vaccines, but the damage has already been done just by simply elevating him to the highest position in our healthcare system. And the doubt that he is sowing is going to take decades to recover from. I already see the impacts of this when I'm caring for hospitalized children, whom we often offer the flu vaccine at hospital discharge. And just the evolution over the past 5 years, those conversations are taking longer to convince parents that the flu vaccine will benefit their child, whether they're previously healthy or not. And that's just a microcosm of the amount of time and effort it's going to take to regain trust in the healthcare system. And we're only a few months into this administration. And so I'm just so deeply concerned about the impacts it's going to have on, decades worth of building trust in the public health system and the healthcare system. And I think what people don't understand is, if parents are choosing not to vaccinate their children because they don't trust the advice they're getting from their doctors, that jeopardizes adults, immunocompromised adults with chronic health conditions. Because if we start to see the spread of these preventable infectious diseases, it's going to affect the most vulnerable. It's going to affect people on chemotherapy, people who have autoimmune conditions and have to take immunosuppressant medications. So it's going to affect all of us. And it's just, he is the least qualified American probably to serve in that position. Is deeply distressing.
Extremely. I saw him swimming in that creek or whatever that was. Nuts. Okay, we've got a question in the chat from Chris DeVries out of Beaufort. Do you know if there will be a greater impact of the proposed Medicaid cuts passed by the House Committee on states like South Carolina that have not adopted Medicaid expansion? And I think maybe Dr. Andrews, you want to take that or?
Yeah, I can start. And you're right. We're one of, I believe, 10 states remaining who have not expanded Medicaid, which means we already have a greater proportion of our population that falls into that gap where they are either uninsured or underinsured. And Congresswoman already mentioned that Medicaid is the largest insurer of America's children and the largest insurer of South Carolinian children. So yes, it will disproportionately affect states like ours, where we have a greater proportion of children who are living in poverty. And this will devastate the budgets of all of our large healthcare systems in the states. I think people don't understand that the Medicaid funds that fund so many Americans really keep our public hospital systems afloat. And so even if you or no one in your life is insured by Medicaid, if they rip the rug out from under these folks who are currently insured by Medicaid by cutting $880 billion from the budget, all of the sudden our emergency departments are going to be more crowded, because if you lose your insurance, you lose access to primary care or your medical home. And so then if you are someone who doesn't have insurance and you have early symptoms, you stay home because you don't have access to healthcare. You stay home until you're sick enough that you can't take it anymore, and then you show up in an emergency department because that's the only place you can get care. So our emergency departments are going to be overcrowded. Our healthcare systems are not going to be able to make ends meet. So then when you show up with your child or with a family member with a simple injury or illness, you're going to have to wait longer. So this is going to affect all of us. America's healthcare system cannot function without Medicaid funding.
I just add that it will also be devastating for rural healthcare, which I know is important across your state. It's important in my district. Rural hospitals will close. We know that nursing homes, senior care, like those 24-hour memory care facilities, those facilities will close without the influx of Medicaid payments from that population that is served. And so I would just say, even if you are in a state without the Medicaid expansion, even if you are in even an affluent community, the impact of the Medicaid program is deeply ingrained within our healthcare system. And the fragmentation that we already experience, the disparities that we already experience, all of those things will get worse if this tax bill is successful. And you all have to remember that they're doing all of this. They're cutting your healthcare. They're taking away SNAP, which is literally taking food out of the mouths of hungry babies across this country, to pay for a tax cut for the billionaire donors that were in the front row of Trump's inauguration. And so it doesn't have to be this way. There is another option, right? Like there's an option where we can expand healthcare and we can pass a child tax credit and we can help working families, but they have chosen this other path of harm and chaos. And it's deadly.
Thank you. And it kind of goes right into this question from Horry County. South Carolina has yet to expand Medicaid. What can be done federally to encourage or compel states like ours to expand coverage?
Well, I would just say at this point in time, we are very much in a mode of protecting what we can. We know that in states that have elected to put that Medicaid expansion on the ballot, it has been successful. And so I don't know if that's a possibility for folks in South Carolina, but that might be something to consider as a ballot initiative. I would also say that at the federal level, that match, so the proportion that the federal government contributes to support the care for that expanded population, is something that is also subject to negotiations right now. And so I know that you all have a number of Republican representatives in both the House and in the Senate. And so this would be a great time, like literally tomorrow morning, to call them and let them know that we want to protect Medicaid, or hands off Medicaid, so to speak, and to protect that federal match in particular. It's essential.
And I will add to that, that frankly, we have to start winning elections. We have to win elections to expand Medicaid, to protect what we already have. And a huge part of that is something Congresswoman brought up at the beginning of the call, which is messaging. People don't understand the Medicaid program. They don't understand how it impacts their life. So we need more lawmakers who can communicate effectively about the benefits of a program like Medicaid so that we can hold Republicans accountable at the ballot box so people understand what they're voting for and against. I saw a really interesting statistic this morning that there is not a single congressional district in this country where over 15% of the voters want to cut Medicaid. Medicaid is an incredibly popular program. It covers 30 million children. It covers 8 million low-income seniors, 6 in 10 people who live in nursing homes, 15 million people with disabilities, 4 in 10 births are covered by the Medicaid program. It is essential to the health of our healthcare system.
So Annie, do you want to tell the folks what the Medicaid program is called in South Carolina?
Well, since we didn't expand it, I think it's mostly known as Medicaid.
Oh, really? Oh, okay.
Yes.
Like where
Yes.
I live, ours is private. So people have an insurance card, it might say Centene or Molina or All Kids or something like that. And so that contributes to the confusion
Yes.
because they have an insurance card that says the name of a company and they don't know that they have Medicaid and that they're
Our
helping
Medicaid
people,
card
right?
says Medicaid.
Oh, wow. Well, that's real clear. Okay, so guys, friends, tell a friend to call the Republicans.
Here's a question from the chat, y'all. I'm not a medical expert, so I don't know if I read if it's redundant. I'm sorry. So this is from Dr. Sharon Black, PhD, LISW. I currently work in FQHC. How do you see the MK cuts affecting these centers?
Okay. Well, Annie, you want to take it?
I mean, I think just to add some clarity to the question, a federally qualified health center is a safety net part of our healthcare system. So the way that I, as a pediatric hospitalist who cares for hospitalized children, interact with federally qualified healthcare centers is very often if I'm discharging a patient who is uninsured when they arrive to the hospital, and our case managers work diligently to try to see if they can qualify for Medicaid or some other insurance retroactively, there's no one for that patient to follow up with because most of our private practices will not accept, they won't even make an appointment for an uninsured child. But where these federally qualified health centers come in is they will accept these patients. And that's the only place often, I've worked both in South Carolina and in Washington, D.C., often the only place I can send patients for follow-up. So a patient who was newly diagnosed with asthma, newly diagnosed with diabetes, it is an important part of our safety net. I don't know the specifics of how the proposed Medicaid cuts will affect funding for those centers. But again, like Representative Underwood said, we are in a defensive posture right now. Anything is possible to expand services like that. We're going to have to win more elections. And right now, we just need to preserve as much of our existing healthcare system as we can.
I would just add that federally qualified health centers do receive separate federal funds to support their construction and a little bit of operational funding. But the majority of federally qualified health centers remain open because they are able to bill Medicaid so they can be reimbursed for the medical services that they provide in caring for those folks that have Medicaid coverage. That's what also then allows them to be able to offer healthcare to uninsured people, right? Or at very low rates because they are being reimbursed by folks who have this Medicaid coverage. So I would expect if this $880 billion cut were to go into effect, we would see a complete collapse of our federally qualified health centers, our community health centers. And, there's a lot of people who assume that charity, philanthropy, that donations can make up for this type of a cut. But there is not a replacement. There's not enough generous donors in the world to make up for the loss of this type of healthcare program because we're talking about half of kids in this country.
And I see that Helestine has told us it's called Healthy Connection Medicaid. Yes, it is Healthy Connections Medicaid. Thank you, Helestine. Another question in the chat is, I Let's see, sorry. I have done, well, this is Terry. She's saying that she's called her representatives, but we're dealing with hardcore Republicans and they're not listening or replying. What would you say to folks like that? Because we do have some pretty committed activists. Like, what would you say about some of these colleagues who I know you probably know who they are? Like,
Yes.
best, what should they be saying?
Okay, I love this question because here's the reality. Do we really expect them to call us back? Do we expect them to write us back? Let's let go of that expectation. The most important thing that you can do when you call a member of Congress office, you're not going to speak to the member, you're going to speak to probably an intern. And that person answers the line, they're going to be very polite. This is your invitation to share your story. Keep talking. Impress upon them the harm that they are imposing on your community. You want them to understand at such a visceral level that when they hang up, they are trembling to go talk to their chief of staff and tell them about the interaction with you. You have the power in this interaction. They need to know. Okay. And if it's a weekend or a district week that's coming up, like Memorial Day week, when all the members of Congress and all the senators are going to be at home, listen, these guys don't do town halls, but they show up in the community. They go to the grocery store, they go to some ribbon cuttings, they go to see their friends at the chamber. You know what I mean? They go to Republican friendly places. Well, guess what? We can pop up at those places too. And we can have a conversation where we share our stories. The advocacy can continue even if these folks are entrenched. It's okay because we are winning. We are winning. We have them in a corner. But this is the final round of the fight, at least in the House, for the next 2 weeks. And so we need to keep that pressure up because right now, today, they do not have the votes to pass this. It passed out of committee, but they do not have the votes to pass it on the floor. This is how I know that we are winning. They're sending us home early so they can do their divide and conquer pressure techniques on all these Republicans because they need to regroup. Okay? So please make your calls. Don't give up on these Republicans from South Carolina. Light them up. Okay? Jam the phone lines. Make sure that they hear from you tomorrow.
Thank you for that. You give us a little bit more, like, just don't give up. We're almost there. So thank you for telling us that we're winning. So from Oconee County Dems, I've read that 65% of skilled nursing home beds are paid for by Medicaid. How can we leverage this message to help elect Democrats? Seniors tend to be more politically engaged. Anybody want to take that?
I mean, I think that's a great point and a fact that most people don't understand about the Medicaid program. They think of Medicaid, they think it's a handout for poor people who don't work, and nothing could be further from the truth. And I think really, the Republicans are so good at these simple sound bites that it's, 6 out of 10 nursing home beds are funded through the Medicaid program. All of us know someone or love someone who is in a nursing home. And I often tell people when I'm talking about how to be an effective advocate, how to effectively call your member of Congress, be persistent to the point of wondering if you are obnoxious. Say the same thing all the time, every day, and that is how you break through. And we have to start doing a better job of that. We are serious people. The representative and I both have a scientific background. We like a lot of data, but that doesn't break through. We get lost in the numbers and we get lost in lecturing people about all of the data, and we need to boil it down, just like you just did, to a simple point. 65% of nursing home beds are funded by Medicaid. Why are you taking away my grandma's nursing home bed?
Exactly. Okay, Tim Lewis, I'll read this compliment. This is from Libby. Libby says, this is so empowering. This is empowering information. We are so depressed that our GOP representatives have not responded to our concerns. Thank you for inspiring us to light them up. Tim Lewis, I understand that the HHS grant funding Meals on Wheels funded for our seniors has already been cut and or eliminated. What role does the states have in continuing to fund these programs like Meals on Wheels for our seniors?
So you're right. In these early days of Donald Trump's administration, they have cruelly gone and cut so many grant programs that make a big difference in our everyday lives. A lot of these, they would acknowledge, were done on accident, right? They had an AI program run and then they just let the computer do its thing, and then all of a sudden folks are going hungry and they don't know why. And so what that means is it's going to be really important, again, for you to be in touch with your representatives, because we are beginning a process called appropriations, which is how the Congress, and solely the Congress, according to our Constitution, has the responsibility to fund federal agencies and programs. And so while Donald Trump can attempt to illegally, unlawfully cut grants like Meals on Wheels, the Congress can come in and restore that funding. And so as Democrats on the Appropriations Committee, we are fighting so hard to get the maximum allowable funding for these essential programs. But we need your help, right? Because these bills are going to come to a vote, and we need the Republicans to know that they have support from their constituents in funding these programs, because they don't want to make Donald Trump mad, right? We know who they really care about, but they need to understand how the impact that these programs have in their communities, okay? So that's the second level call. So once you do your Medicaid call, we're going to call back about these essential grant programs that are really important, because a lot of our states don't have an ability to make up for those dollars. If that grant is gone, the state cannot, in many cases, fund these essential services, often life-saving services in our communities.
Awesome. We have a technical question here. Hi, I have Blue Cross Blue Shield health insurance through Obama plan. I paid low cost for both dental and health insurance. Would that fall under Medicaid due to the low price?
Oh my gosh, I don't know who answers this question, but I'm so excited. I'm so
Antoinette
happy to
Ray.
meet you. Hi, because I wrote the bill that allowed you to get this low-cost health plan. Okay, so here's the deal, friends. Under the Affordable Care Act, you can visit healthcare.gov. Is that what you all use in South Carolina? Healthcare.gov? Okay, healthcare.gov to sign up for a plan. So maybe you're a young person and you just got kicked off your parents' insurance and you need to go and find a health plan. Or maybe you're an entrepreneur, or maybe you need some special medicine that your job doesn't offer in their healthcare plan, right? For whatever reason, many people visit healthcare.gov and they are surprised to see that there are truly low-cost plans available thanks to some very popular tax credits. 4 out of 5 people can now get a plan for $10 or less a month. I know, like for real, $10. And so what the Republicans are doing is that they are going to let these tax credits expire at the end of this year. They refuse to put an extension in this bill. Like, they are choosing the path of harm. So we were so excited to work with President Joe Biden to get these tax credits expanded in 2021. We extended them, meaning they were available for longer in the Inflation Reduction Act in 2022, but they're expiring on New Year's Eve this year. And so we are fighting so hard to find a way to extend these tax credits. So it's not just Medicaid, you're absolutely right. It's people who have Obamacare, or they visited healthcare.gov to sign up for their healthcare coverage. And that's really being threatened right now. And so, but we have to remember, friends, in the United States, we the people have the power. We have more power than they do, but we have to remind them of that every now and then, and making the calls right now is essential.
All right, Dr. Andrews, as a pediatrician and advocate, how do you see the connection between mental health and gun violence?
It's a great question.
That was the wrong one, but go ahead.
You want to ask a different question? It's two devastating epidemics that have a lot of intersectionality. And, I think one of the great myths about gun violence is that it is driven by people with mental illness. And, most homicides have nothing to do with mental illness. Most unintentional shootings where young children gain access to an unsecured firearm have nothing to do with a mental illness. People with mental illness are far more likely to be the victims of gun violence than the perpetrators of gun violence. But we cannot ignore the youth suicide crisis we are facing. And speaking of things that the Trump administration is defunding, they're defunding the hotline for suicide prevention, and specifically suicide prevention for LGBTQ youth. So these are two incredibly overwhelming public health crises that are impacting the youth in South Carolina more than the youth in many other states, because we do not have a robust mental health infrastructure for young people or anyone in the state of South Carolina. And we know that we are number 6 in homicide across the entire country. So we are feeling the burden of both of these crises more than most people in this country. And we have a state legislature that has been controlled by Republicans forever, essentially. And these problems are their problems. They have created these problems and they refuse to enact solutions. There are common sense, evidence-based solutions to both of these problems, but we don't have in South Carolina enough lawmakers with the moral courage to do what is right. You know, we have Senator Lindsey Graham tweeting today about how we're such a pro-life state. And nothing could be further from the truth, because we turn away from our gun violence epidemic, which is the leading cause of death for children in this country. We're turning away from the mental health crisis in this country and in this state. And our children deserve so much better. But again, we have to play defense. But I love what Representative Underwood is saying, that we need to continue to be loud. Having lived here for so long, it can be so frustrating to call the same representative and the same senators year after year after year and never see them take a vote that you have asked them to take. But they still need to hear from us. They must hear from us, because slowly we will chip away at them. And the more of us who call and say that we want to see action on gun violence, we want to see action on more robust mental health services, eventually we're going to get to where we need to be, because the option to stay silent is not an option. We have to get loud until we can build the South Carolina that we know we all need and deserve.
Awesome. Okay, Congresswoman Underwood, your Momnibus Act has brought maternal health to the forefront. What progress have we seen and what's next?
So as you all may know, in the United States, we lead the industrialized world in preventable maternal death. And unfortunately for Black women, our pregnancy-related death rate is off the charts as compared to our white counterparts. We're 3 to 4 times more likely to die of pregnancy-related complications than our white counterparts. And for every death that we see in this country, we have 70 near misses, right? And so we all end up knowing someone who, I certainly had a friend who died. I know that so many of us may have these similar stories, if not a friend, a coworker, a neighbor, a family member, right? It's just devastating, this epidemic of pregnancy-related deaths that occur in the Black community. And so when I was elected, I wanted to work on this issue. When I teamed up with Alma Adams, she's a congresswoman from the Charlotte area, and started the Black Maternal Health Caucus. And it's bipartisan. It's one of the largest bipartisan caucuses on Capitol Hill. And we wrote a bill called the Momnibus. It's now 14 bills designed to address every clinical and non-clinical factor contributing to preventable maternal death here in the United States. And so we've had one of our bills signed into law to help our veteran moms, because even within the VA system, we see these disparities and elevated pregnancy-related deaths. And so we have a lot of work to do. We've also, through appropriations, that process of funding agencies and programs, been able to get over $200 million in funding to support our Momnibus priorities, even though the whole bill hasn't been signed into law. Y'all, we went and got that money, okay? And that money has been coming to states like yours, for real. And so that's an area to really be encouraged by. However, again, in the first 100 days of Donald Trump's administration, we started to see him begin to target our maternal health funds. So for example, down at Morehouse, they had a multi-million-dollar grant that was cut. We saw them fire an agency director for our lead agency over at NIH that does maternal health research. And so we are really standing and protecting the gains that we have made while we are working in a bipartisan way to advance the Momnibus this Congress, right? We have to do both, because these dollars are critical to saving lives in your community and in mine. And we can't let our eye off the ball.
And just to top that off, just so everyone is aware, there are only 8 states with a higher maternal mortality rate than South Carolina. We rank 42nd with deeply embedded racial health inequities in that. So we have so much work to do on that issue.
Wow. Okay, let's get a question out of the chat. This is from Julie Lumpkin. What is your advice about whether we should reach out to other Republican congressmen if in South Carolina if we live in Congressman Wilson or Clyburn's district? Should we truly focus on our reps only, or given the state of affairs, be justified in reaching out to all of our Republican reps?
I think everyone should hear from you. I think folks should know the impact of their votes on your state. And so my advice is to make calls.
Action alerts, sign up for our action alerts. We'll get one tomorrow about this, I'm sure. Let's see, we got another question. I'm trying to go back and forth from the chat to the previously submitted. Okay, Dr. Andrews, what are the biggest gaps in reproductive care for South Carolina women?
They're large and growing larger as we become a more and more hostile state to pregnant women. You know, I, for a long time, worked at one of the academic institutions in this state, and I have already seen the brain drain effect of the extreme abortion bills that have passed at the state level, in addition to the federal environment around this issue. If you are a future OBGYN graduating from medical school, why would you come to a state like South Carolina to train where it might be illegal for you to provide evidence-based care to a pregnant woman who shows up in your emergency department? So the downstream effects of the political environment on the abortion issue in South Carolina are so much bigger than we even understand. There are far too many counties in this state that don't even have a single OBGYN. So pregnant women have to drive across multiple county lines just to seek regular pregnancy care. At the same time, we have a Republican legislature saying that they want more women to be pregnant, and they, you know, are such a pro-life state, and their positions are so hypocritical and they conflict with each other. And so it is a scary, you know, I have 3 children and no plans to be pregnant again. And I am grateful because I would be scared to be pregnant in a state like South Carolina. There are huge gaps, and they are only going to get worse as we continue to see these anti-abortion extremists legislate our reproductive freedom.
All right, I know Rep. Underwood has a hard out here in a few minutes, so I want to give her this opportunity to answer this question from Oconee County. Could you give us a rough idea of what percentage of health care research, parentheses, cancer, Parkinson's, etc., was funded by the U.S. government under past administrations, and how that research is being affected by the current administration?
I don't have numbers for you, but I can tell you that once again, there's no amount of like philanthropy that's going to make up for the cuts that we're seeing coming out of the Trump administration. What it means is that we will no longer have the ability to innovate and find that next cure. We're not going to invent that next technology or tool or medical device that makes your recovery easier. You know what I mean? We're not going to discover a new technique to reduce the risk of infection, right? Because we're not going to be funding those studies. And so I also, we're not going to be supporting more providers, right? And their education. And so then that means fewer doctors and nurses and surgeons and, you know, all psychiatrists and everybody in our communities, and especially not in rural areas. And so the impacts of these cuts is significant, and there's not a safe landing place on the other side coming from private sector dollars. And so, you know, if we want to find a cure for cancer, if we want to end preventable maternal death, if we want, you know, to be free of chronic illnesses like diabetes, right? We have to invest in the life-saving research. And America is the place around the world that is known for our excellence, for rigorous study and then incredible breakthroughs that save lives around the world. No one else can do what we do. And so we have to step up and continue to fund these life-saving programs.
Thank you. Annie, you have anything you want to add to that?
Yeah, just that here at home, this has already impacted the budgets of our two large academic medical centers, tens of millions of dollars from their annual budget that just was gone overnight. And, that impacts their ability to educate the next generation of the healthcare workforce, and it impacts their ability to provide high quality clinical care to South Carolinians. And it is devastating, it is reckless, and they're attacking it at all different angles. And, it has had a chilling effect on biomedical research. And as Congresswoman Underwood said, we are the world leader in biomedical research, or at least we were until a couple of months ago. And, you don't know who in your family is going to benefit from the next breakthrough in cancer treatment or the next breakthrough in Alzheimer's prevention or cure. And it is heartbreaking to see decades worth of science just grind to a halt.
This is so empowering and informative and saddening all at the same time. But I do want to pause right here because I know Rep. Underwood has another engagement that she needs to get to, but I want to take a moment to thank her so much for joining us and just being a part of this important conversation. And please, you're welcome to come back anytime. We know you were already here before. You were in Barnwell. You've been a couple places I remember.
Yes.
But please tell our participants how they can support your future endeavors, your current endeavors, excuse me.
Well, the best way that you all can support me right now is to make sure that you are calling the Republicans and telling your healthcare story and asking them to protect Medicaid, to extend our ACA tax credits, and to vote no on this dangerous, deadly tax bill. Okay, that's the way forward. Thank you so much for your advocacy. I look forward to seeing you in person on the ground in South Carolina again one day soon. And Dr. Andrews, it's really been a pleasure. Thank you, Crystal.
Thank you so much. All right, Dr. Andrews. Okay, another question. Let's see. What policies would you champion to lower prescription drug costs for working families?
I think this is such an important issue because it affects my practice as a physician every day. I think it's important to take a step back and say we in America have a profit-motivated healthcare system. We do not have a patient-centered healthcare system. We have a profit-centered healthcare system. And when people think about the high costs of healthcare, whether it's a visit to the doctor's office, an unexpected emergency department visit, or going to pick up your prescription drugs at the pharmacy, and they need to understand the reason the costs are so out of control is not because of the healthcare providers. It is because of the pharmaceutical industry and the insurance industry. And so there is a reason that we have not lowered prescription drug prices, and it has nothing to do with what is best to make America healthy again. It has everything to do with who spends the most in lobbying dollars and political donations in Washington, D.C. The big pharma has incredible power in Washington, D.C. But the Biden administration had made really, really incredible progress on this exact issue in the Inflation Reduction Act, capping the cost of insulin to $35 a month. Some patients were paying thousands of dollars for their monthly insulin. Here in South Carolina, we have the highest rate of amputations from vascular disease that is due to diabetes.
Zip code too. The zip code.
Yes. Yes. I mean, it is an astounding statistic that has everything to do with the failure of our healthcare system and nothing to do with the great people of South Carolina. So the Biden administration showed us how it could be done, capping the cost of insulin, capping the cost of prescription drug prices to $2,000 out of pocket a year. And it is possible. We just have to make it a priority at the federal level. We have the negotiating power, as the Medicare program has the negotiating power. We just need to make it a priority. And what I see happening now, there's been headlines in the past 24 hours about the Trump administration trying to lower prescription drug prices. I think they understand that this is a deeply popular policy position, but executive orders aren't going to get the job done. You know, we had an incredibly effective Congress under the Biden administration that passed law after law that actually impacted people's lives in a positive way. And an executive order and a headline from the Trump administration is not going to get the job done. This is an incredibly solvable problem, and it's one that we also need to be calling our representatives about because it impacts every single one of us.
All right, we got a question in the chat from Jim Horsch down in Aiken. I have a friend that worked, you talked about this a little bit too already, Dr. Andrews. I have a friend that worked at the CDC in Atlanta. After 33 years, her last day was May 9th. What is your best guess before we see the results of the brain drain at the agencies that have kept us safe and healthy?
I think it's a really important question. I'm so sorry about your friend. I have heard so many stories like this. Effective public health, when it's done correctly, we don't even know it's there. We don't even know all of the ways in which it's making our drinking water safe, all of the ways it's making the groceries we buy at the grocery store safe to consume. And we have taken it for granted. We have taken it for granted. And I don't think any of us anticipated the extreme degree to which the Trump administration has really attacked every single facet of our public health infrastructure. You know, we've talked a lot about healthcare funding, Medicaid funding, Medicare funding, but he has completely disrupted the NIH. We just talked about biomedical research, and he is disrupting our entire public health infrastructure by attacking the CDC. I think one example of this is, you know, I do a lot of work in gun violence prevention. I have a colleague who spent months writing a research grant to submit to the CDC because under the Biden administration with the bipartisan Safer Communities Act, we had finally increased the amount of funding we had to study the problem of gun violence. She wrote this grant, she submitted it to the CDC, and then the election happened and it literally got thrown in the trash can. No one will ever read that grant. The funding went away overnight. And so, you know, there's too much chaos to even keep up with, but and I think that's part of the strategy, but it is going to take, again, I've said this multiple times, decades to recover from the attacks on institutions like the CDC and the FDA and the workforce that has dedicated their lives to keeping Americans as healthy as possible, and they're losing their jobs left and right.
Okay. Mr. Randall Hughes, many GOP-led states expand Medicare. South Carolina has not. Have South Carolina Democrats sought to co-sponsor an expansion bill with willing South Carolina Republicans?
So I certainly can't answer what's happened behind the scenes that I am unaware of, but in my interactions with Republican members of the South Carolina legislature, there is not an appetite to expand Medicaid. They don't want to chip in the, you know, $3 on 10 that our state would have to chip in. And it is a huge missed opportunity because, you know, I got asked this question in my debate and I regret the way I answered it. So I'm going to answer it better now. You know, someone said, well, how are you going to pay for that? How are you going to pay for Medicaid expansion? Well, it pays for itself because primary care and preventative care lowers the cost of healthcare across someone's lifespan. And to me as a pediatrician, when so much of what I do is preventative in nature, nothing could be more clear to me. But if we invest in primary care and people getting their cancer screenings like people get at Planned Parenthood, but they can't get anymore because of the Trump administration. If we invest in, you know, routine child wellness checks, well child checks, this will lower the cost of healthcare over each patient's lifespan. So it is a cost-effective approach to invest in quality health insurance for every American.
Great answer. I love the way you answered that. So we've got a question from Ed Wright. What are your thoughts on the South Carolina Supreme Court decision today on Planned Parenthood South Atlantic versus South Carolina, banning abortion when a heartbeat is detected around 6 weeks?
I have a lot of thoughts about that. That is not an evidence-based piece of legislation. It's not an evidence-based law. It has nothing to do with the actual process of becoming and being a pregnant woman. I'm sure most people listening understand that the heartbeat is nothing more than cardiac activity, electrical activity in fetal cardiac cells. Most women don't know they're pregnant at 6 weeks. And so this is just a creative way to pass a restrictive abortion ban. And it is devastating. I tweeted something at Lindsey Graham today because of his obscene anti-woman, anti-science, anti-abortion position that 1972 called, and they want their legislation back. Because we've said this all along that I have two daughters. My daughters have fewer rights than my mother had when she was growing up. And that is deeply disturbing. And I understand. I'm so glad that Representative Underwood was here to give us a little bit of sort of a viewpoint from another state with a different landscape, because we can't lose hope in South Carolina. I know as well as anyone how easy it is to start to feel hopeless when we see headlines like this, but we can't stop fighting because the women in South Carolina need us to fight for them.
Yeah, fight like hell. That's just got to be our motto.
That's right.
So we've got a question, a previously submitted question from Lexington. And I guess it's kind of, not pie in the sky, but looking down the road. How do you see the Affordable Care Act evolving under Democratic leadership?
I mean, I think it's important for us to talk about what you just said, pie in the sky, because I think that's one of the things that we can do better at is helping people understand how we can and have and will continue to make their lives better if elected. So I think there's so many ways that we could expand the Affordable Care Act to improve healthcare access for South Carolinians. There's a lot of creative ways to do it. As Representative Underwood said, we're playing defense right now, but if we think ahead to elections that we will win in the future, we can create a public option. So someone who doesn't have employee-driven health insurance can opt into a program like Medicare. I remember when my parents, who were on private insurance their whole life, got on the Medicare program and they were like, this is amazing. This is so great. This is really fantastic health insurance. And obviously we could all do better at everything, but Medicare is a very, very popular program and people should be able to opt in. We could start lowering the age of Medicare eligibility or make it available to anyone who wanted it. I have a pie in the sky dream, along with many of my other child health advocate colleagues, to create a MediKids program or a Medicare program for Americans under the age of 18. Because as I was saying before, pennies on the dollar spent on children's healthcare will turn around and make it cost effective in the long run. And who can disagree with the idea that every American child deserves access to high quality healthcare? We get so boxed into thinking about what isn't possible that we stop thinking about what could be possible if we had the right leaders in place. And all of our communities would be healthier and our economy would be stronger if our children were healthier and parents could go to work.
Absolutely. So I've got a comment from Antoinette Ray. Hi again, I am an entrepreneur and I also work in the medical field. As you mentioned, we have to let our voice be heard. I am a member of the NAACP. I am a nurse as well. This is why I'm going out tomorrow and passing out flyers for the health fair to our local high school for an health fair event on Saturday. Good for you, Antoinette. Okay, a question from Aiken and Wilbrand. How will DEI bans affect healthcare?
They've already affected healthcare in many facets, including our public institutions that are having to spend their time changing the name of programs, altering programs so the funding doesn't get struck down under these DEI bans, time that could be spent on building out programs to actually deliver healthcare. Grants that include, words like woman, grants that include words like equity and gender are just being canceled. So researchers who submitted the grant got it funded, which is a very hard thing to do. And then all of a sudden the funding is just gone. So now some of their salary support is gone. So these researchers are going to leave states like ours and other institutions, and we get back to the brain drain. But I've talked about this for a long time. So it's this very unhealthy infiltration of politics into science. And, back when I was a much more naive person, I felt so strongly that there would never be this infiltration of politics into the practice of medicine and science as a whole. But we saw the erosion of that with the abortion conversation. I witnessed very upfront and personal the erosion of the wall between politics and science and healthcare with the gun gun violence prevention conversation with what we are and are not allowed to say at certain institutions about that issue. And then with the gender affirming care ban conversation. And so time and time again, politicians were able to get what they wanted from the healthcare institutions in this state. So they're just going to keep asking for more. And now it's DEI bans and, a total chilling effect over the science and innovation that takes place in institutions like USC and MUSC.
I'm glad you mentioned research because I think one of the representatives, our state reps, were talking about it. There was a huge DEI ban conversation a couple of weeks ago, and my light's going off. Sorry, but they were saying that just as you talked about when women are a part of the DEI ban, right? And how illnesses show up in women differently than men. Talk a little bit about that. Like if I'm having, I don't even want to say that, if a woman is having a heart attack versus if a man is having a heart attack, like what those presenting symptoms could be like and how important it is for this research to continue.
Yeah, for far too long, women and pregnant women were kept out of clinical trials. So there's so much we don't understand about basic principles of women's health or the difference between how disease processes present in women versus men. And these grants that include these words like gender and female and male and disparity are being canceled. So we won't learn more about what you just said, which is a devastatingly real statistic, which is that when women present to emergency departments with chest pain versus when men present, and the time it takes for them to get an appropriate, accurate diagnosis, if in fact they are having a cardiac event. I mean, the disparity is breathtaking, and we're never going to learn more about that if under the guise of these DEI bans, we're not going to be able to study the difference in diseases between men and women. And I've heard some folks effectively say, white women think this won't like that the DEI stuff isn't about them because they're white, but it absolutely is about them because they are women. So this impacts all of us. And, it's again, they're just chipping away in every direction. And I don't even know how we're going to pick up the pieces, but I know we're going to have to.
Oh, I think we're running up on 8 o'clock, but I do have one more question in the chat, Annie, if you've got it in you.
Yes.
Martha Edwards. Kids are 22% of the US population, but they are 100% of our future. They don't vote and they don't pay taxes. How can we help amplify their voices in DC and in our state?
It's a wonderful question from a pediatrician colleague of mine, Dr. Edwards, who has been doing this work tirelessly in South Carolina for decades. She's exactly right. Children don't have inherent political power because they don't vote and they don't have 401ks and they can't write checks to political candidates. So it's incumbent upon those of us who care deeply about America's children to build political power for children. That means talking about kids in election cycles, during campaigns. That means holding our elected officials accountable to the votes that they take that directly harm South Carolina's children. And, it's going to take a long time. It's going to be hard work to build that political power. But I will say for those who've been following this energy and commerce meeting that took place all night last night, Dr. Kim Schreier is the only pediatrician in the U.S. House of Representatives. She's the first pediatrician ever elected to the House. She's the only pediatrician there right now. She is on that committee, and we should all be so grateful that she was in that room to talk about the direct impact of these devastating Medicaid cuts on pediatric patients across this country. We need more pediatricians, we need more teachers, we need more nurses in elected positions at all levels. And I guess I will end by saying we have one pediatrician in the House. We have 0 pediatricians in the US Senate. We have never had a pediatrician in the US Senate. Our children deserve better, and I think we can achieve better for them.
Well, thank you so much, Annie. Thank y'all so much for staying tuned. This was such a really informative conversation for me. I hope that folks do feel empowered and ready to call these folks tomorrow because we will be sending out an action alert. But Annie, I do want to give you the last word since you're so gracious with your time this evening. I feel like I'm Lawrence O'Donnell. You have the last word on my Zoom show.
I think I'll just end by saying, thank you for everyone who's here who is so engaged in this process to show up on a Wednesday night when I'm sure y'all had very busy days to listen to this conversation. And I feel more empowered to call our congressional delegation because of what Representative Underwood said. If you haven't done this before, save their office numbers in your phone. And that makes it so much easier when you have something to say, when you have something on your mind, pick up the phone and call. And they tally those calls. It matters. And one of the things I like to do is call before the office is open or after it closes and leave a voicemail. If I don't feel like having a voice-on-voice conversation, I'll leave a voicemail because they're going to tally those calls. They're going to hear in the morning that they had this number of constituents call to say vote no on these devastating Medicaid cuts. So please stay engaged. Please do not lose hope in what is possible in South Carolina. I take care of children every day. I have my own 3 young children in the public school system, and I don't know what I would do if I lost my hope. So stick around with me and don't lose hope. South Carolina can and will do better if we all work together.
Thank you so much, Dr. Andrews. And just as a reminder, folks, if you like this type of programming that we're trying to do to keep folks informed and engaged, please let us know. We're looking forward to our exciting Democratic weekend this coming May 30th and 31st. We're having our big fundraising dinner with Governor Wes Moore, who is the governor of Maryland and only the 3rd Black governor we've had in this country. He's currently the only one. He's a dynamic speaker. And on Saturday, May 31st, we're going to have our state convention. And we're going to hear from Governor Walz, who was just our most recent past vice president nominee for whatever, vice presidential nominee. He's also the governor of Minnesota. So if you're not plugging in with us, please plug in. We'd love to see you at our Democratic weekend. Thank y'all so much. And thanks for staying tuned again. And thank you, Dr. Andrews. We really appreciate it.
Thank you, Crystal. Have a great night.